Today's topic, fascia. So the superficial backline in fascia, we will be talking about what is it, why you might be having pain in your lower sacrum or your lower back, and ways to prevent and treat it. So when you look at the muscular system and the fascia system, there is this prevalent double helix. It's like a crisscross over the anterior and posterior parts of your body. This is a ground force reaction, so there's a spiral line of these which athletes use within the fascial band. These athletes are like baseball players, tennis players, golfers, and hockey players. And from Anatomy Trains, Dr. Tom Myers says that we all cross over through our hips differently. So when knowing anything about fascia, there is 3 types. And with my chronic patients whom deal with sciatica pain, it always makes me ask them the question like, is this really sciatica or is this a fascial adhesion? So the issue is an adhesion down the leg usually that pulls on the low spine. So it's usually not pain, it's pulling. Things we can do to help prevent is mobilize, recondition with endurance training, myofascial release to improve better mobility within the kinetic chain reaction. When we can understand the framework of the human body and the movement patterns for rehab, for structural integration or injuries from chronic pain, we can better manage them. So then we can work to the ground force reaction for better momentum and how we move from the ground up. Many will look for quick fix band-aids because they don't understand, because they're not informed properly or educated enough. When we can understand fascia and the 3 layers that holds us together, and that they're protecting many systems of muscles, bones, and even visceral organs, these spidey-like and thick rubbery bands get stuck together. But when we can get to the root cause, then we can break free from chronic pain issues. So there are many environmental things that can alter your fascia, like dehydration, coffee, tattoos, and isolation training. But with proper conditioning and stretching, there are many fascial bands that cross over the pelvis and the hips, and sometimes adhesions turn to glue-like substance. And from lack of movement or a past injury or even dehydration, this can go into the kinetic chain to pull into the lower back and down, connecting to the fascial bands into the leg. So I hope you found this educational, and stay tuned for the next one.